The Effect of Gait Speed on Rear Foot Eversion by Tim Newens, Andrew McLean, Jared Thompson, Lachlan Townend, and Zoe Heiniger. So what is eversion? Eversion occurs when the sole of the foot faces laterally from the midline of the body. In this presentation, we will be focusing on rear foot eversion. This occurs during the stance phase due to the tibia moving toward the toes to produce dorsiflexion, while the lower leg rotates inwards to produce abduction. Through an analysis of two separate studies, we discovered that the average maximal angle of rear foot eversion during the stance phase of walking and running is approximately 7 and 12 degrees respectively. This gives an average difference of 5 degrees. So where does the current study sit in regards to previous research? To date, there has been many studies that establish that gait speed is directly proportional to the eversion angle. However, there seems to be limited within-subject studies on the topic. Therefore, by performing a within-subjects analysis, it is hoped data can be better matched between the two gait speeds. It has been estimated that the incidence of injuries in runners may be as high as 80%. This is significantly higher than walking. One possible explanation for this large figure may be the influence eversion has on the entire lower extremity, with greater eversion angles posing an increased risk of injury. According to a study conducted by Nishikawa, excessive eversion of the rear foot may predispose runners to various lower limb injuries due to push-off from a less stable foot, as well as excessive stress beyond the elastic region, which may lead to microfailure. As a result, reducing excessive rear foot eversion using methods such as orthotics, strapping, and bracing may have large implications on injury prevention and rehabilitation. In the current investigation, we assess the effect of gait speed on rear foot eversion. Or put simply, we compared rear foot eversion while walking and running. It was hypothesized that an increased speed of gait will increase the eversion angle of the rear foot at the point of contact with the ground. That is, participants will experience greater rear foot eversion when running compared to walking. To test our hypothesis, we recruited a convenient sample of 4 male students from the 2015 Griffith University Biomechanics 1 cohort. A short questionnaire was used as a screening tool to ensure volunteers were fit and able to participate in both walking and running tasks. Importantly, participants willingly gave their consent to be filmed, and were also advised they had the opportunity to opt out at any point during the study. Participants were advised to wear clothing suitable for exercise, including shorts above the knee to allow for marker placement, and running shoes suitable for walking and running on a treadmill. Participants were also advised that they were unable to wear orthotics, as this may have altered the results. Each participant was marked with 4 surface markers. The first was placed on the calcaneal tuberosity, the second on the point of contact with the ground directly inferior to marker 1, the third marker at the intersection of the medial and lateral gastrocnemius heads, and the fourth was placed 5 centimeters directly superior to marker 3. Once the markers had been accurately placed, participants were instructed to walk on a treadmill at a speed of 2 miles per hour for 2 minutes. The last 30 seconds of the 2 minutes was filmed. However, participants were unaware of this. For comparison, the process was then repeated with participants running at a speed of 6.5 miles per hour. The video camera used was set to sports mode and was positioned posteriorly to the treadmill, with filming taking place in the coronal plane to ensure all markers were visible. As both walking and running are performed in a single plane, 2D analysis was used to measure the angle of eversion. To undertake the kinematic analysis, the collected data was uploaded in its raw form to Silicon Coach. Between markers 1 and 2, a line was constructed and was extended superiorly. In the same way, between markers 3 and 4, a line was constructed and extended inferiorly. The external angle created by the intersection of these two lines was measured as the angle of eversion. 3 examples of this kinematic analysis using Silicon Coach are displayed here. Using this program, we were able to measure 3 stance phases during the final 30 seconds of each speed. The study contained one within-group independent variable, which was the speed of gait, a comparison between running and walking. The dependent variable was the measured rear foot eversion angle. Controlled variables included the time spent at each speed before filming, the use of footwear, the placement of markers, the distance of camera from the treadmill, approximate age, height and weight of participants, the use of participants with right leg dominance, and the measurement of rear foot eversion in the right foot. So what did we find? In support of the hypothesis, gait speed was shown to have a significant influence on lower limb kinematics, in particular, rear foot eversion. And compared with walking, running showed a greater angle of eversion during the stance phase for all participants. We calculated the average difference in rear foot eversion to be 2.75 degrees between running and walking, with the largest difference occurring in participants 1 and 4, who both showed a difference of 4 degrees. It should be noted that angles of eversion during walking varied between participants, potentially influencing the overall difference between gait speeds. This could be explained by variation which naturally occurs between individuals. It is important we give consideration to potential limitations of the current protocol. Due to time constraints, only 4 participants were tested, all of which were males. And although participants were instructed to wear footwear appropriate for walking and running activities, footwear varied, potentially influencing the degree of rear foot eversion. Subjective marker placement also leaves room for potential error when calculating joint angles. Although rear foot eversion has been investigated previously at a variety of gait speeds, there are limited studies which directly compare walking with running. There are also limited within subject studies. This study therefore provides new evidence in regards to the influence of gait speed on rear foot eversion. It is currently known that running presents a higher risk of injury in comparison to walking, as well as the fact that a greater angle of eversion exposes tissues of the lower limb to a greater degree of stress and strain. Furthermore, it could be proposed that an increase in rear foot eversion witnessed during running could provide a mechanism for increased risk of injury. However, since a cause-effect relationship has not yet been established, there is potential for further investigation. If we can establish a relationship between rear foot eversion and injury, it may be possible to reduce the potential injury risk from running by using mechanisms which reduce rear foot eversion.